Hello, everybody. My name is Travis Dye, and I'm from Daniels, West Virginia, which is close to Beckley. I have four dogs that range in ages from 1 to 14. For my hobbies, I like to go to the lake and spend time on my boat, jet ski. I like camping, riding my four wheeler, and side by side. I like doing anything with the dogs, whether it be taking them for walks or runs. They like to swim, enjoy uh, working on my cars, doing any type of DIY projects. I also like to travel. I've been to most of the Caribbean islands. I'm always up for a new adventure, and there's not too much that I won't at least try. And that is stress relieving and fun at the same time. A lot of you may not realize that before I got into nursing, I used to be a public school teacher. I taught high school for 7 years and I made the change to nursing. I went to WVU School of Nursing. After I got out of there, I accepted a job and worked in the operating room for a little while. And then I left there to do some state funded nursing, working in geriatrics through some state programming. I was able to do that. I also worked 2 weekends a month in mental health. And then latest job before the job I have currently is I worked for infection preventionist at a local nursing home. I did that for a little while as well. And now I'm back to the state funded doing geriatric care. So I definitely find some parallels between that and family nurse practitioner work. And I like it because it's more one on one. And that kind of is the reason that I want to pursue the MSN degrees to kind of give back to the community, to be able to enhance my knowledge and skill set, and to be able to pass that on to future RNs and nurse practitioners. So that's the reason that I want to pursue this family nurse practitioner program. Also, I think as part of that, the vision is to get back to spending more time with our patients, being able to sit down, actively listen and engage with them, and figure out their problems, develop a rapport with them, so that not only are they more compliant, but when we have a suggestion, they're more apt to listen to it. And rather than going in and rushing out of the room and already kind of have an idea of a diagnosis before a provider even gets in the room, because um, although we meet good providers and good RNs in the profession, unfortunately, we see some of the ones that aren't in it for the right reasons as well. So, a couple goals that I have for the class, I actually wrote a few down, so let me find them here. The first one was to learn how to use APA better. Although, you know, we seem that we're good at it, it's a bear to get. It's a beast, and it's also been some time since I've utilized it. So hopefully, do better with that. And also, I want to incorporate some studies that give some of the latest trends and knowledge so that we can provide that best care possible as a family nurse practitioner. The problem is with that, kind of one of the barriers is it may be the best practice today, but in 2 years, 2.5 years, when we're out in the field as family nurse practitioners, it might have changed already. So it's a kind of constantly evolving, kind of fluid field that you got to keep up with, or you'll be lost kind of with in the past with your knowledge. So that encourages you to engage in EBP. So I'm looking forward to the semester. I look forward to reading your comments. And if you want to know more, just message me. I'll be happy to share more. Looking forward to the semester. Thank you.